Awards 2017, hosted annually by the Times Network and now in its third edition, has become a thought leadership platform on powering the country's digital economy. And the Digital India Hero Series is an attempt to highlight the award-winning, groundbreaking digital initiatives that are transforming India's corporate and socio-economic landscapes alike. Welcome to the Digital India Summit Winner Series, tying tradition with technology to make medical records wearable across rural India is young social enterprise Khushi Baby. We visited their headquarters ourselves to understand how. With a near-field communication necklace that stores medical records for mothers and children alike, Khushi Baby is quickly closing in on the country's immunization quandary. With its fully integrated data-driven end-to-end solution, here's a company that makes a clear case for how a digital spin can make for a medical win. Let's start off with some statistics. How many babies die in our country each year from vaccine-preventable diseases?
In India, it's estimated that 500,000 children under the age of 5 die from vaccine-preventable disease every year. Of course, this is only an estimate. We don't actually know. And that also is part of the problem. It's an unacceptably high number, 500,000, but we also don't know which specific kids are not receiving the vaccines that they need in the first year of life. So the statistic is a problem, and the fact that we don't have the statistics is also the problem.
So what's Khushi Baby's approach to bridging this immunization gap?
So we have vaccinations, which we just discussed, but really vaccinations and infant care falls in a spectrum. It's our goal to ensure that along this spectrum, we empower both the patients as well as the health providers to get the best services and to make the best decisions about those services. We want to make sure that each patient has a durable and reliable copy of their own medical record. In this case, it's something that they can wear and something that means something to them. For the health worker who's going into the villages at the front line, we want her to be empowered with digital technology that allows her to be confident in the decisions that she's making. And finally, we have the health official. The health official right now is looking at aggregated data. And as we mentioned before, this data is not really a reliable indicator of what's happening at the field, especially at the last mile. So it's our goal to provide that health official with reliable data, with timely data, but most importantly with data that can be used for decision making. So we've designed the whole dashboard to ensure that we have smart lists. With one click, you can see which nurses are facing which shortages of which vaccines, or which nurses cannot perform the hemoglobin test because they didn't have the hemoglobin equipment functional. With one click, you can see which mothers are due for delivery in the next week. These are the kinds of report formats, along with many others, that we've made in order for various different stakeholders on the management side to take direct actions on a week-to-week basis.
Well, this solution is intended for the most marginalized of communities. How does the design reflect their limited exposure to technology?
Design is really core to what we're doing here. In many cases, someone can build a technology and hand off a technology without really understanding the end user's needs, and what ends up happening is that technology stays on the shelf. For us, we are looking at the end-to-end solution, iterating upon our designs, then actually deploying that technology. So how do you train these nurses? How do you communicate with these families? Monitoring and evaluating is also the last and key component for our whole end-to-end solution. So we're actually involved in all aspects of this in order to ensure that the technology is so-called appropriate. Now specifically, when we came here in 2014, we had an idea that we wanted to have some kind of wearable medical record. And we were debating, should the child wear it, should the mother wear it? And through this process, we actually came into contact with the local jewelry. We learned a little bit about the local customs. And something very important came out from these discussions. And that insight was that the children are already wearing black thread, black necklaces, kala dhaga, which has a symbolic meaning of protecting the child from evil eye or buri nazar. And we saw this as a great opportunity for us to slot into something that's not only culturally acceptable, but culturally symbolic. This wearable necklace is something that we've seen in the field from our trials. It's something that is much better retained than the paper card that the government gives out. Up to 5 times more retention when you get to 6 months of the baby's life. That's important because for the same issue, when the patient comes to the health worker doesn't have the record, then how is the health worker supposed to take the specific action that this baby needs? And this form factor, by the fact that it is better adopted and better retained, allows for that interface to be maintained. That's the first part. We started off with designing an interface that can read and update a child's immunization record. And after talking with government officials, we quickly realized that the government is actually tracking things that are beyond immunization. It's tracking the entire scope of maternal and child health. So we looked at the National Health Mission guidelines, and we looked at each and every one of those columns that they're tracking. And we had to figure out a way to put these 150 columns of the register into a tablet-based app. But that was just one part of the challenge. We also had to figure out, okay, we have all this data that we have to collect. How are we going to put this in an intuitive form that any nurse can use? We are happy to say that we've been able to make something that really does integrate into their workflow. And one of the key components of their workflow is that they work in a place that's completely offline. They're working in the last mile, the most remote regions, where you may not even have the ability to send an SMS. So our platform needs to be robust enough to work in those scenarios. And there are several ways that we achieve this. So we've designed the platform to be completely connectivity independent. So as a nurse, if I see a patient, I can scan their necklace, I can get their medical record, I can verify the patient, I can give the patient the medications they need today, and I can save their medical record. And next month, they can go to the next nurse, they can go to the PHC, they can go to the district health hospital, and that linkage of data remains preserved.
For any public health initiative to gain mass adoption, partnering with the right organizations and building an ecosystem around the solution itself is critical. What steps have you taken in that direction?
Yeah, so public health is nothing without partnership. And for us, we are very lucky to have a village of partners who are coming to support us. We started off as a university project, so our first partner was Yale University, and soon after the Indian Institute of Health Management Research in Jaipur. The support of institutions like UNICEF, Gavi, Bill and Melinda Gates, from the health and policy standpoint. From the research standpoint, we've had the support of organizations like 3IE, the International Initiative for Impact Evaluation. Besides those partners, we are also very lucky to have the support of technology partners. So we are working with Safran. Safran is a large multinational technology company, and we are working with their identity and security department. Software development, we also have partnerships. So Mobisoft Infotech out of Pune, we've been working with them for the past 8 months now, and we're very lucky to have them and the engineering support that they provide. Beyond those institutions and partners, the biggest partner for us, of course, is the local support that we have here with the Udaipur district government. And their support is crucial because ultimately it's the district government under the National Health Mission umbrella that is implementing all of these services.
What are some of the challenges you faced in scaling the Khushi baby system? And once you achieve that scale, what's next?
Scale for us starts with working with the government. There are over 2.5 lakh A&M nurses or frontline nurses who are going and taking care of maternal and child health related issues. And they take care of about 25 million newborns every year. So these are our users that we hope to scale. We want each one of these nurses to have a tablet that's running the Khushi Baby platform. And on the order of around 20 to 50,000 district health officials at different levels who are using our dashboard. That's the broader vision.
There's a multidisciplinary team in place here of just 25. What are the drivers? What brings them here? What motivates them every day?
Their prime motivation is they want to do something that's different, and they want to do something that can make an impact. And they're willing to take a risk to see that change and be a part of that change. The kind of people that are joining our team are people that can wear different hats, who can, adapt. So I think that's part of the energy that is really unique about our team. Really, it's this interdisciplinary mix of ideas which makes a project like this possible, because it really does touch on all these different aspects. It touches on design, from what kind of jewelry is the mother wearing to what does the app look like. Of course, really what puts it all together and what cements it is when you go to the field and once you experience this solution actually coming together. Once you've put in all the hard work, all the late nights, all the weekends, and you've worked tirelessly to build this application, and we see babies coming back wearing the necklace. We see incredible stories of mothers who have to cross rivers, or even mothers who are blind who are coming to these kinds of health camps. And to think that now, when they show up to this health camp after going through all this effort, we can at least ensure that they have the right record and they'll be receiving the right treatment on that day. That's an incredibly rewarding feeling.
With its socially symbolic necklace, robust mobile app, and cloud-based dashboard, Khushi Baby is rapidly redefining how vaccination data is captured and deconstructed. By unlocking a child's vaccination history with the simple scan of a computerized chip, Khushi Baby is empowering health workers with access to an infant's immunization records where it matters the most, at point of care.